Alrighty guys, so we are going to talk about bedside reporting, and I know we have had an extremely busy day, but let's just go through this real quick. We know we need to be doing it, there's no question about it. We've gotten really lazy about it, all of us, myself included. So at the change of shift, oncoming nurses and outgoing nurses will be doing bedside reporting. No questions. We of course have the exceptions, and everybody has a copy of the guidelines, so we'll talk about all that. So to do the bedside reporting, I've kind of made this quick guidelines. Obviously, you know what you need to tell the nurse regarding your patient, but just a checklist. Obviously, the patient's name will go over, allergies, and that makes sure that we don't miss any allergies, especially if you have a patient that came in and wasn't so sure about them before, and then their family shows up and they're like, oh yeah, so-and-so's allergic to this, 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 and this. We'll assess that. Code status, definitely need to go over code status in our older folks. Checking vital signs. This will put you ahead of the game as a nurse coming on to shift. If you already know your vital signs are good, or obviously if you come on and your blood pressure is 80/40 and this has not been happening and we don't have any pressures or fluids running, this can be addressed right then and there. You don't get flagged by at 8 o'clock. Pertinent labs and checking charts. Big. We have all of our cows, and we've all been trying to use them with this new system, but with the new system, we're often missing pertinent labs, and that is big. We will have a troponin that's been elevated for an hour or two. That's ridiculous. We can't be having that. And this will help because we'll have the nurses that are oncoming nurses and offgoing nurses. We can talk about it and see what needs to be addressed. A potassium of 3.1. Let's make sure the provider's seen that, or we've fixed that. Assessing for bathroom needs. Speak to your patient. See if they need to go to the bathroom. Do you need repositioned? You have another nurse there to help you at that point. So check with your patient, and that way by 7:30 you've already seen all your patients. You've already repositioned, taken them to the bathroom. You've got them good. They're all fixed up, and you're ready for the rest of your shift. Speaking with the patient and the family, especially if they have any questions at that point, and letting them know what we're doing. Are we waiting on CT to come and get them for a scan? Are we waiting on a bed assignment from our supervisor? This is big, and this is one of our biggest complaints here in the ER. Patients are waiting for hours and not knowing what they're waiting on. At least give them something. Tell them that we are waiting on a bed assignment. Tell them that we're waiting on, a medicine from pharmacy, something, instead of just leaving them high and dry and them not knowing. Making sure the call light's in reach, the bed is in the lowest position, your seizure precautions, make sure those are done. Bed rails up, obviously. Urines too. If you know your patient has not urinated and you're giving a report, make sure that's addressed at the time too. Remind the patient, hey, we're still waiting on a urinalysis from you. You think you can go now? We can go and do that real quick. Obviously, there are exceptions to bedside reporting here in psych and throughout the ER. But if you have a patient that has been super agitated, cussing, swarping, hitting, you don't have to do bedside reporting. Obviously, that is not going to work out for the patient. The patient is probably going to get more agitated that you're bothering them. If you've finally gotten somebody medicated and they're asleep, Lord, do not wake them up. Just let them sleep on through. Let's see. If there's any possibility that you are thinking maybe a child's being neglected at home, or, if you have a sexual assault case and she's just had to tell, her sexual assault to 4 different people, don't relive that at the bedside. Those are exceptions to this. Checking your IV patency in the infusions too when you're at the bedside. Make sure you check your IVs while you're checking your vital signs, and making sure everything's running smooth, that you didn't infiltrate, Levophed or something like that. Obviously something that needs to be running at that moment. And making sure that we're not causing the patients any harm. Biggest thing with the bedside reporting is talking to the patient and the family. Obviously, a report is important, but we need to keep the patient and the family made aware of what's going on and making sure that they have no needs. And that is going to be the biggest thing to enhance our patient satisfaction, is making sure that, you know, the patient feels like that we care, that we're at the bedside, we're worried about their labs, we're talking to them about it, because a lot of times we get busy and we don't tell the patients all their lab results or, you know, what we're waiting on. Two, obviously the safety. I mean, fall risk patients especially, if you're doing that 30 minutes of report at the desk, one of your patients could have easily gotten up, fallen, and then you're going to find them at 7:30. You have no idea what had happened between 7 or 7:30. So that's a big thing too. And our psych population. Obviously, they need to have 15-minute walking rounds, and that's what we do try to do. But doing the bedside reporting, or even just walking by and saying, hey, you need anything, especially if they've been agitated all day, that's going to help us tremendously. That makes sure the patient's okay, and you don't have to worry about them for a couple minutes. Those are the biggest things. You know, we got to be doing bedside reporting. It's going to enhance everything tremendously. Obviously, our patient satisfaction, our nurse satisfaction, because we're not going to find out at 8 o'clock that their IV has been infiltrated for an hour, or that their Levofed was running at 5 and it was supposed to be at 15. It's just going to help everybody out, including patients, families, staff, management. I mean, it's going to work really, really well. So, alrighty guys, we're going to do bedside reporting.